So Lance, why don't you tell the audience, how and when you got into this space?
Yeah, so for me, and I've shared this before, I was extremely, extremely close to my grandparents, probably almost as close as I was to my parents. And that wasn't a negative thing against my parents. It's just my grandparents on my mom's side lived down south. And so, like my kids today, I tell them how lucky they are. They can see grandma anytime they want because grandma's works full time for our company and she lives right by us. I didn't have that luxury with my grandparents. So from the time I was old enough, I would go spend, at first it was maybe 2, 3 weeks. And then as I got into school and a little bit older, it would be the whole summer down there with my uncles and cousins and just had a great time. And it got to the point where my grandmother developed dementia, unbeknownst to anyone in the family. And she came to live with us up here, which was fantastic. And for people that think differently, I would use this as a textbook example of why engagement, stimulation is so crucial. When we did pick her up, and I was the one that actually drove down to get her, and she came to live with us, it was a whole reversal in her cognitive abilities, her mood, everything, and you could really see a change. Well, but eventually dementia does progress, and as it got worse and worse, she had to go into a facility. And I would literally go and sit and just hold her hand. She became nonverbal, and I never will forget it. Aides would come by or nurses, and I'm there almost as long as they are for their shift, and they're like, aren't you just the greatest grandson? And they would actually compliment me and go and get another aide and say, look at this, which in a way is kind of sad that that's more of the exception than the rule, right? As we all know, sometimes loved ones go in these facilities and you might go on holidays or Mother's Day or Father's Day or on a birthday, but you're not there regularly with them. And I was holding out very naively the hope that I could maybe cure her, right? Just by being there and try to re-engage. And that left a profound impact on me. Well, it got to the point where she did have to go into hospice, and I remember it was my wife and I got married in October, and we had our first Christmas, and everything's wonderful. Later that day on Christmas Day, one of the uncles called and spoke to my mom and said, "You guys really need to come down. The hospice nurse wants to see us all together." So my wife and I, did our Christmas. She stayed behind, and my mom and I drove down, and it's like a 7-hour drive. And we had this meeting with the hospice nurse, and the hospice nurse starts talking about, hospice and what's going to happen and all these things. And, one of my concerns actually was, are you going to be medicating my grandma with morphine? And now, other than my mother, who was a nurse, the rest of our family are lay people. They don't know what I'm even talking about. And the hospice nurse, you could see, because I was only 23 at the time, maybe 22, she was very surprised by that question. Like, she did not have a good answer. And my thing was, I don't want to prolong any suffering, which my grandmother was not in suffering, but I also didn't want to expedite her demise and her passing either, and, she said, well, we'll only give it if necessary. Well, my mom actually, she stayed for a couple of days. I ended up staying for the next 3 weeks. I literally stayed right there at the hospital, and I was staying in a hotel across the street, but I'd be there from sun up to sundown. And, I finally had to come to terms with, she's not getting better. Like, this is not going to end well. And she did pass, but, my thing was, it just left a profound impact on the way it felt like the healthcare system viewed somebody because A, they had dementia, B, they are elderly. Like, I don't want to paint a broad brush with a broad stroke, but it seemed like there was no value placed on them as much as if I was in my 40s or 50s or 60s and I, was dealing with something. It was just almost like they were just trying to move it along, if you want to use that phrase. And then fast forward, years later, my father lives with my wife and I, and here I'm back in the role of trying to be there for him and do all these things while, I'm pursuing medical school. And so to answer your question, how long or why did I get into it or when? I feel like it started in my early teens because I always planned to be a physician. I never wanted to be anything but that. But then when I saw the need that families have with like the situation I went through with my grandmother, the situation we went through for 2.5 years with my father, albeit entirely different circumstances, I just had an epiphany, like, we need to do something to help these other people that are going through situations like us, because the healthcare system isn't there to support them. They're not trying to connect them to resources. And if we're going through this and we're educated people and we're vibrant, healthy, what are people that aren't as fortunate going through? You know, I didn't know about all these other resources out there. And so we decided to start a company where we help family caregivers, and a majority of it is seniors. So I would say probably in my teens is when I got into it, but not professionally speaking.